Hi, my name is Noah McDowell. I'm a current third-year osteopathic medical student at Comp Northwest. The specialty I'm currently interested in applying to is general surgery. I'm interested in applying to general surgery because I really value the immediate problem solving that comes with surgery. You're able to help someone fairly quickly with whatever their acute issue is, and then send them on their way to continue to heal. I like that ability to immediately help someone and kind of fix a problem that I can, tangibly get my hands on and solve. And I really love that aspect of it. I also love the hands-on aspect and being able to do something instead of prescribing something and just wait. I like that kind of immediate go, go, go type of setting and the environment that general surgery creates. The height of professionalism in the OR, everyone knows what their role is, what they're doing, and they take care of each other in the OR, and I really appreciate that environment. I want to learn more and hopefully apply to general surgery residencies. And that brings me into what it means to be an osteopathic physician. I find there are a lot of similarities actually between osteopathic medicine and surgery. Osteopathic physicians can, help someone with hands-on techniques and kind of immediately relieve that pain. But more than that, I find it valuable that osteopathy focuses on the patient as a whole, one body, mind, spirit, all together in one, and that is what we focus on as osteopathic physicians. Instead of seeing, this is the diabetic, this is the patient with hypertension, we say, this is our patient, Jan or Carl or whatever their name may be. And they have these things, but that's not what we see when we approach these patients. We see them as individuals, and we treat them as individuals. And I really appreciate that about osteopathic medicine, because I think sometimes that gets lost in the medical world, and we just, let patients come and go, thinking of them only as their problem. And I think, this type of thinking goes down all the way to the fact that when we do osteopathic manipulation, we think of what is their position of ease. That's a very basic thing, but that's how we frame it. We think about what is their norm, what's comfortable, and what's their ease, not what's their problem. We think about them in kind of a more positive light. And I hope to continue to, hone those tenets of osteopathic medicine and incorporate them into whatever field I decide to go into, if that is surgery or if not. And I think that's kind of what sets us apart from our allopathic counterparts, is those tenets of osteopathic medicine, that we do see the patient as a whole, and we see their ability to self-regulate and to heal, and we focus on that in them as individuals instead of being very problem-focused. And so thank you for your time, and those are my thoughts on osteopathic medicine.